بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. اللهم أخرجنا من ظلمات الوهم وأكرمنا بنور الفهم وافتح علينا بمعرفة العلم وسهل أخلاقنا بالحلم. اللهم ارزقني نعمة الإخلاص لوجهك الكريم بكل ما أقول وبكل ما أفعل. آمين يا رب العالمين. My topic today is a short talk about coronary arteries anatomy, and we will see this anatomy in CT angiography, coronary angiography. Here, CT scan at the level of the aortic valve. As we see, the aortic valve has cup-like configuration or cusp-like configuration and has three sinuses or cusp: the left one, the right one, and the non-coronary one. The left coronary artery arises from the left one, and the right coronary artery arises from the right one. And the non-coronary sinus, no arteries are arised from this. As we said, the left coronary artery arises from the left coronary sinus or cusp, and this is the left main coronary artery, and it is divided to left anterior descending artery and circumflex artery. And the left coronary artery between the right ventricular outflow anteriorly, as here, and the left atrium posteriorly. Here, another 3D volume rendering image, left coronary artery, as we see here, and this is the left anterior descending artery, and here we see the circumflex artery and some branches of the left anterior descending the diagonal, and the branches of the circumflex, it is obtuse marginal. Here, axial CT cuts, as we see. Here, this is the aortic valve, and here, this is the left atrium, right ventricle outflow, and left atrium, right ventricle outflow. As we see here, the left main artery, left coronary artery, and here we see the left anterior descending artery, and here we see the circumflex artery. Here, this is the left anterior descending artery. As we said, it travels in the anterior interventricular groove and continue to the apex of the heart, and it is supplied the anterior part of the septum with septal branches. These are the septal branches arises medially, and the anterior wall of the lateral ventricles, and it is supplied by the diagonal branches D1 and D2, and these are on the lateral aspect. The LAD supplies the most of the left ventricle and also the AV bundle. The diagonal branches come off from LAD and runs laterally as we said, and the septal branches are runs medially. The first diagonal branch serves the boundary between proximal and the mid-LAD. And we have more than a diagonal branch. And D between the mid and the distal, D2. The second branch of left main coronary artery is the circumflex artery, as we see here in the axial cut CT scan and here in the lateral projection. The circumflex artery, it is in the left AV groove between the left atrium and the left ventricle and supplies the vessels of the lateral wall of the left ventricle, and has its branches. It is called obtuse marginal, and it is numbered M1, M2, etc. And they are supplied the lateral margin of the lateral ventricle and in the obtuse angle. In the most of cases, the circumflex artery ends as obtuse marginal branch, but 10% of patients have dominant circulation in which the circumflex artery supplies the posterior descending artery, BDA. In about 10%, BDA it is supplied by circumflex artery. Here, in about 15%, a third branch arises between the left main, this is the left main, this is the LAD and the circumflex here, and the third branch, it is called ramus intermedius or intermediate branch, and it behaves as a diagonal branch of the circumflex. And this is normal variant. The right coronary artery, as we see here, this is the 3D image, and this is the reformatted image on the CT scan. As we see here in the right coronary artery, arises from the anterior sinus of Valsalva and courses through the right ventricle and right atrium to the inferior part of the septum. In 50% to 60%, the first branch of right coronary artery, it is called small conus branch, as we see here branch, conus branch, and that supply the right ventricle outflow. In about 20 to 30%, the conus branch may arise directly from the aorta. In 60%, a sinus node artery arises as a second branch of the right coronary artery that runs posteriorly to SA node. And in about 40% also, this is arises from the circumflex artery. The next branch are some diagonals that runs anteriorly to supply the anterior wall of the right ventricle. In about 65 of cases, posterior descending artery is a branch of the right coronary artery, and we call it right dominant circulation. The BDA supplies the inferior wall of the left ventricle and the inferior part of the septum. As we see here, this is acute marginal branch, and this is the BDA. Here, this is another 3D volume rendering image. We see the acute marginal branch and the coronal branch. Our coronal branch and acute marginal branch, as we see. And here we see the distal right coronary artery, and this is the BDA, and it is supplies, as we said, the inferior part of the right ventricle, and it is dominant in this case. And this is the anterior margin. Here, this is CT axial cuts. We see the right coronary artery in the arterioventricular groove between the right atrium and right ventricle. And here, this is the conus branch, arises from the coronary sinus. And this is the right coronary artery, and this is the circumflex artery, and this is the LAD with the diagonal branches. Here, this is anterior projection, as we see here. This is the right coronary artery, and we see the acute marginal and the BDA here. And here, this is the left main coronary artery. This is the circumflex with its branches, obtuse marginal 1, obtuse marginal 2. And here, this is the LAD with its branches, diagonal 1 and diagonal 2. Here, this is the right coronary artery and the left coronary artery with its main branches, LAD circumflex. And here, this is the lateral projection, the LAD with its branches, diagonal 1, diagonal 2, and it is the circumflex with its branches, obtuse marginal 1, obtuse marginal 2. Thank you for listening and hoping to see you soon in another talk. سبحانك اللهم وبحمدك أشهد أن لا إله إلا أنت أستغفرك وأتوب إليك.